Has Big Pharma opened COVID-19 can of worms? I ask that because after all these years, we keep finding new details about the COVID vaccines. In a big move, AstraZeneca has now decided to withdraw its COVID vaccines worldwide. This is according to a Telegraph report. The vaccine can no longer be used in the European Union because the company has voluntarily withdrawn its marketing authorization. The firm submitted the application on the 5th of March. It came into effect on Tuesday. More of these applications will be made in the coming months in the UK as well as other countries that had approved the vaccine known as Vaxzevria. The decision brings the use of the jab to an end. But why is this happening? According to AstraZeneca, it is purely for commercial reasons. The pharma giant has said the vaccine was no longer being manufactured or supplied because updated vaccines that tackle new variants have taken over. In a statement, the company has said, and I'm quoting, as multiple variant COVID-19 vaccines have since been developed, there is a surplus of available updated vaccines. This has led to a decline in demand for Vaxzevria, which is no longer being manufactured or supplied. AstraZeneca has therefore taken the decision to initiate withdrawal of the marketing authorizations for Vaxzevria within Europe. The government largely stopped using the Oxford AstraZeneca vaccine by the autumn of 2021. By that time, it had supplied about 50 million doses in the UK. It was replaced in the UK with Pfizer and Moderna jabs in time for the winter booster campaign. The timing of this withdrawal is interesting. Recently, AstraZeneca had admitted in court documents that its COVID vaccine can lead to some rare side effects. It had said, and I'm quoting, "It is admitted that the AstraZeneca vaccine can, in very rare cases, cause TTS. The causal mechanism is not known," quote unquote. Now, for those who do not know, TTS is short for thrombosis with thrombocytopenia syndrome. It involves the formation of blood clots and a fall in the platelet count. The blood clots can appear in the brain or abdomen. There are claims that people have been diagnosed with TTS after taking the jabs. One of them was Jamie Scott. He has filed a case against AstraZeneca. Scott was 44 when he received the vaccine shot. 10 days after the jab, he complained of tiredness and started throwing up. And soon his speech was impaired. When he was hauled to the hospital, doctors diagnosed him with a suspected case of TTS. Scott was left with a permanent brain injury. Over 50 such cases have been lodged against AstraZeneca. Earlier, we spoke to Venugopalan Govindan. He lost his 20-year-old daughter, Karunya, in the year 2021. Listen in to what he had to say.
We are in the process of finalizing the details and the team and the whole contours of the process of filing a case against Serum Institute and the government authorities, bodies that did the vaccination for all under 45, 45 plus and then the 18 plus in India. We cannot run the risk of the same things being repeated in this country either in our lifetime or in children's or grandchildren's lifetime ever again. We need systemic safeguards. That is the first reason for which we want to take this to court.
However, AstraZeneca has maintained that the decision to withdraw the vaccine is not linked to these court cases and the timing is purely coincidental. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.